Good morning, everyone. So, my next video, which I'm going to discuss with you, is on the critical appraisal prescription exercise 3. After a long period of time, I'm putting my video on my YouTube channel, and I hope it is helpful to you and it is useful to you. So, this is critical appraisal of prescription exercise 3. Earlier, I have discussed with you 4 exercises of critical appraisal. In this video, I will discuss with you another 2 exercises of critical appraisal of prescription exercise 3. So, what is it? It is the suitable prescription for a patient who is suffering from acute attack of angina pectoris. And patient is also suffering from bronchial asthma. But here we need not give the prescription for asthma, but the patient is a sufferer of bronchial asthma as well, and he is suffering from acute attack of angina pectoris. So the patient details are given, but they are not full in this prescription. And diagnosis acute attack of angina pectoris. Tablet Glyceride trinitrate 5 milligram oral once daily. Here the tablet is full form is not there. That is short form is there of tablet, but we have to write full form. This trinitrate is not given orally; it is given sublingually. So sublingual injection, sublingual tablet is available, which is placed below the tongue and it is absorbed. Means after every 3 minutes we give the nitroglycerin tablet up till 10 minutes, up till maximum of 10 to 15 minutes, so that the attack is aborted. Propranolol, it is the beta blocker, so it can be used, it is used only in the prophylaxis of the asthma. It is a beta blocker, so it will block beta 2 receptors and it will cause the bronchospasm because it blocks the bronchodilation and it causes the bronchospasm. So that will lead to precipitate the attack of the asthma. That will worsen the asthma. Thus, it is used in the prophylaxis of the angina pectoris. The tablet 600 milligram stat. We give the tablet 75 milligram stat. 600 milligram is the dose which is analgesic. Analgesic and antibiotic dose is 600 milligram. And the dose of the for the antiplatelet action of aspirin is 75 to 325 milligram. So we give the low dose and for the antiplatelet action to come. And then we can say that the follow-up is missing and doctor's signature and date is missing. Format is incomplete, doctor details are not here. This is what is wrong in this prescription. Now, this critical appraisal is format is incomplete, short forms used. This is the tab is used. We have to use the tablet. Tablet, glycerol trinitrate is a drug of choice for acute attack of angina, but route of administration is not oral. It is sublingually to avoid first pass. Why we give the sublingual tablet? Because we have to avoid the first pass metabolism of the liver and have the maximum bioavailability to have a rapid action and other nitrates like isosorbide dinitrate can also be given sublingually in the acute attack. And tablet aspirin at a dose of 600 milligram is having analgesic action, which is not required in this anginal pain. We have to give the in this anginal pain, we need not give the anti-anginal, analgesic action. Aspirin is, however, given in the dose of 75 to 150 milligram, which has the antiplatelet action. We give the dose of aspirin as the antiplatelet action of the drug has to come. So we give the aspirin the dose of 75 to 150 milligram. Propranolol is used only for the prophylaxis in angina pectoris. There's no role in acute attack. can be given to patient after the acute attack subsides. Means after the acute attack subsides, we can give them Panadol in the prophylaxis of the angina pectoris, but it will block the beta 2 receptors, causing bronchospasm and can precipitate attack of bronchial asthma. Instead, isosorbide dinitrate and calcium channel blocker can be given. We can give calcium channel blocker for the prophylaxis or for after the acute attack of angina, or we can give isosorbide dinitrate. Signature of doctor and date is missing. Follow-up period is not given. This the signature of doctor and date is also missing, and follow-up period is not given. Now these are the doctor's details, and then this is the name of the doctor, registration number of the doctor, address of the doctor, contact number of the doctor, and this patient's details, diagnosis. Treatment is tablet nitroglycerin, 0.5 milligram, one tablet kept under the tongue every 3 minutes till maximum 10 minutes. Tablet aspirin 75 milligrams. That means immediately we give the tablet aspirin, which is antiplatelet in action. And when the acute attack subsides, we have to give the prophylaxis with tablet isosorbide dinitrate, 20 milligrams 3 times a day for 15 days, and tablet aspirin has to be started. 75 milligram has to be started once a day for lifelong treatment. Follow-up after 15 days, signature of the doctor and date. Now, next prescription is write a suitable prescription for a patient suffering from high-grade fever due to Plasmodium vivax malariae. So, as you know, in the Plasmodium vivax malariae, we give the two drugs, chloroquine and primaquine, the main basic drugs. Here, the primaquine is missing. Primaquine is the drug which is given for the radical cure of Plasmodium vivax malaria, which attacks in the exoerythrocytic phase of the Plasmodium vivax malaria. So, paracetamol for the treatment of the fever, and chloroquine is given in the dose of the 600 milligram stat, followed by 300 milligram after 6 hours, and followed by 300 milligram once a day for 2 days. This is the dose for the chloroquine, and paracetamol is given, and primaquine is given, which is 7.5 milligram. For the 14 days, we give it. And the chloroquine is having the bitter taste. So to mask some bitter taste, we can give the antiemetic drug like metoclopramide or domperidone, so that before taking the chloroquine, approximately half an hour before taking the chloroquine, we can give the antiemetic drug domperidone and metoclopramide, and paracetamol is given for the fever. Here the dose of chloroquine is correct, incorrect, and paracetamol is also the dose is incorrect, and OD you have used. OD is not to be used. We have to write them once a day full. Now, critical appraisal, format is incomplete, short form used like tablet. Tablet chloroquine is drug of choice in this patient, but the dose given is incorrect. It is given in the loading dose of 600 milligram chloroquine phosphate stat, followed by 300 milligram after 6 hours, then chloroquine phosphate 300 milligram once a day for next 2 days. So this is how we give the chloroquine phosphate tablet. Then paracetamol can be given for decreasing the fever, but the dose is incorrect here. Antiemetic like domperidone or metoclopramide can be given half an hour before giving chloroquine, as it causes nausea and vomiting. It has a bitter taste, and chloroquine causes nausea and vomiting. So we can give domperidone and metoclopramide along with it just half an hour before. Primaquine is required for radical cure after giving chloroquine. After giving the chloroquine, we can, for the radical cure, we can give primaquine. for eradicating exoerythrocytic phase of the Vimex malaria. Signature of the doctor and date is missing. So this is the doctor's details in the upper right hand side of the page, followed by the patient's details. Then the treatment is tablet chloroquine phosphate, 600 milligrams stand, then 300 milligrams 6 hours later, followed by 300 milligrams once daily for 2 more days. Now tablet metoclopramide, 10 milligrams before each chloroquine tablet for 3 days. Tablet paracetamol, 500 milligrams 3 times a day for 3 days. Tablet primaquine, 7.5 milligrams 2 times a day for 14 days. Avoid mosquito bite and signature of the doctor and date. This is the treatment for the Plasmodium vivax malaria, full treatment. How we have to give the treatment for the patient suffering from Plasmodium vivax malaria. Is we have to give chloroquine phosphate for 3 days, then metoclopramide for 3 days, 10 milligram. Paracetamol has to be given to combat the fever. Primaquine for the radical cure after chloroquine. So this is the treatment of the Plasmodium vivax malaria. Thank you. That's all for my video on critical appraisal of the prescription exercise 3. I hope you like this video, and if you like this video, kindly subscribe to my YouTube channel, that is Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be safe, be blessed. Thank you. Be blessed. Thank you.